Hello all, welcome to the AETCM Emergency Medicine channel. As said before, we are going to start with the MRCEM videos. So there are a lot of changes that is going to happen from 2021. So there are certain name changes that is going to happen from this year onwards for the exam. So I just wanted to emphasize what are the major name changes and what you need to prepare for the MRCEM exam. So there is basically three part of exam. You can take it from India as of now, and we will go through each exam and how to prepare. So what we thought is that we will start with the part B videos, because part A is basically to deal with all your anatomy, physiology and your basic sciences, whatever you learned in your undergraduate days. So it is more specific to emergency medicine, starts from the part B onwards. So we thought we will start with part B videos. So part B, there are certain name changes as I said before. So let's see what are the major name changes that is going to happen from 2021. So there are different nomenclature that has been called for the MRCEM exams. So the current name of the first exam that you need to appear is FRCEM Primary Single Best Answer. That is the name that has been given right now, but it is going to change into MRCEM Primary SBA, Single Best Answer. So that is a new nomenclature that is going to happen. So as you are aware, the part 1 exam, previously it was a true or false exam. It was like 4-5 years down the line, and now they changed it into an MCQ sort of a question. So approximately you will have 180 questions, because why I said approximately, it will be 180 questions, but there will be some deletions from those questions because of the improper phrasing or some problem with the question, somebody raises a concern. So RCM, Royal College of Emergency Medicine, usually deletes few questions in the primary exams. So basically it is the primary exam, that is the first exam that you need to appear. Soon after finishing your undergraduation, you can apply for your primary exam. So now the new nomenclature is MRCEM Primary Single Best Answer. That, let me clarify, MRCEM Primary Single Best Answer. So that is a new nomenclature. As I said, it will be 180 questions. So you can think that maybe 10 questions they will delete. So out of 170, you need approximately 100 marks to clear this exam. So it will vary from year to year. It all depends upon the difficulty of the exam, how your peers are appearing well for this exam. So this all depends of the cutoff mark. What exactly you can make somewhere around 60%. You can calculate that around 60% is needed for clearing this primary MRCEM Primary Single Best Answer. So there is a separate curriculum which is easily available in Royal College of Emergency Medicine. You can download it and you can go through it. Now the second major change that has happened right now, that is the FRCEM Intermediate SAQ. SAQ in the sense short answer question. So it is previously called as MRCEM Part B. Now they are re-nomenclating it as MRCEM Intermediate Single Best Answer. So this is one of the biggest change that is going to happen from 2021. So previously it was a short answer question. It is like a question will be asked, and under that maybe a scenario will be given to you, maybe a trauma scenario or maybe a pictorial representation will be given to you, and you will have 3 sub questions or 2 sub questions beneath that, and you need to answer that. So you will have 60 those sort of scenarios, and each questions used to carry around 3 marks. So it was 180, again it was 180. So to clear that exam, it was suppose the cutoff was somewhere around 110 to 120. That used to be the cutoff for the FRCEM Intermediate SAQ. Now they have changed it as MRCEM Intermediate Single Best Answer. So it is again a sort of an MCQ question, but the curriculum they have not, I feel that the curriculum they have not changed. It is the same curriculum that of the SAQ that is going to happen for the MRCEM Intermediate Single Best Answer. So that is a major change. Maybe in this March will be the last sitting for the SAQ exams, and after the March it is going to be Single Best Answer. So it is again going to be 180. We'll see how they have been planning this in the coming slides. Now there are few other nomenclatures like FRCEM Intermediate SJP that was being called, and it has been renamed as MRCEM OSCE. From India, what all exams you can write this? You can write these 3 exams, that is the MRCEM Primary Single Best Answer, MRCEM Intermediate Single Best Answer, and MRCEM OSCE. So when you clear these 3 exams, you are eligible for a degree of MRCEM. So that is a degree awarded at the completion of your 3 sets of exams. So after the 3 sets of exam, you need to continue. You will be eligible for your GMC registration, and depending upon your language skills, there will be sometime you need to go through your IELTS or OET, or some institution will give you exemptions for that, and you can join in a middle grade job in UK in emergency medicine. So you will get you are eligible for a GMC registration after this. So that is your MRCM OSCE. So it is again OSCE. Again, it is going to be obstructive structured clinical examination. You will have scenarios where you will have adult scenarios, pediatric scenarios, trauma scenarios. All those things needed to be done, and you will be evaluated by the examiner. So that we will discuss in the coming videos. So primarily these are the major changes that is going to happen from 2021. The major change that is happening is with the SAQ. SAQ is being replaced by single best answer. These are all news given in the RCM website. So regarding that SBA exam, there is no much clarity regarding the curriculum. So I feel it is going to be the same curriculum that has been used for the SAQ. So the again exams of 2021, the current examination will finish in spring summer 2021, and new examination structure will be introduced from August 2021. So that is the announcement from the Royal College of Emergency Medicine. So again, what I said, MRCM primary SBA first sitting will be on December 2021, and it is again single best answer paper assessing basic sciences underpinning EM care. Blueprinted to the basic sciences curriculum, same format as FRCM primary. So there is no change in the format, no restriction in the currency of a pass in FRCM primary. Existing pass in MRCM Part A between August 2012 and August 2016 remain valid. Prior unsuccessful attempt at the FRCM primary will be counted. So that is the announcement regarding the exams for 2021. These are all taken from the Royal College of Emergency Medicine website. Now coming to the most important change that is happening is the MRCM intermediate single best answer. So previously, as I told, it was the SAQ. Now they have changed it into single best answer. So first sitting, it is from September 2021. So as I said, it is going to be a single best answer paper assessing understanding of the full range of condition and presentation that may be encountered in the emergency department. So it is going to be 180 questions presented as 2 question paper within 2 hours per paper. So that is again usually 180 question they used to give 3 hours. Now what they have done is 180 question they have split into 2 and they have made into 90 questions paper with 2 hours per paper. So we are going to get little bit more time to answer this. It will replace the FRCM intermediate SAQ and MRCM Part B, which have a similar syllabus though a different format. So that is what they have said. There is not going to be any syllabus change, only the exam format is changed. Existing passes in MRCM B after 2012 and MRCM intermediate SAQ remain valid. So those who have already completed SAQ, they are eligible for your OSCE exams. Prior unsuccessful attempt at the intermediate SAQ will be counted. So you have already attempted twice or thrice. There is a number of attempts that you are eligible for. So the previous failure will also be counted here. Now coming to the OSCE, MRCM OSCE. So the new OSCE pattern that is going to come from first sitting from November 2021 objectively samples the clinical and communication skills of trainee and ensures that they are those of someone ready for higher training. So you need to be a true professional when you go for the OSCE exam. Will replace the intermediate SJP exam. So SJP usually it will not happen in India. We only had the OSCE exams. So that is the major change that is going to happen. So regarding the OSCE exam. Now let's go into the details of, as I told, we will be concentrating more on intermediate. So we'll just see what is the syllabus for the MRCM Part B or FRCM SAQ, which was the previous nomenclature. The FRCM Intermediate Certification Exam or MRCM SBA is conducted in English, and candidates are advised that an IELTS level 7 is the expected standard for completion of the FRCM exam. So previously they used to send a mail to your supervisor asking that whether you have IELTS grade 7, because a minimum of IELTS 7 language is needed to understand this exam and need to appear before the exam. So that is the previous requirement. They used to send a mail to your supervisor and they will ask regarding this. But these days, this sending an email to your supervisor and all those things are not happening. So this is the major change that has happened that is going to happen from 2021. Now let's see the curriculum category. So RCM has not said anything specific regarding the change of curriculum or change of syllabus. They said that it will be the same as that of the SAQ. So this is the curriculum that is available for the SAQ. So you will have basically seven categories. One is the common competencies. Two, clinical presentation. You have core, major and acute presentations. You should have a basic anesthetic competencies. And again, acute care common STEM. This is the intensive care medicine within acute care common STEM. So that is again we will see what are the subheadings contained under these categories. And again you have acute presentation, additional adult presentation which has not been covered in the major and acute presentations. And you have pediatric presentation, again major and acute, and practical procedures. So these are the basic 7 categories that they are going to assess you. And coming to the common competencies, why I have put 7 is that in SAQ there used to be 7 questions from competencies, from common competencies. It is going to be a single best answer into 3. That means you have to anticipate at least 21 questions. That is my calculation, because common competencies previously it was 7. Now they have increased the number of questions, so it is going to be into 3. Previously it was 60. Now they have increased to 180. So into 3. So approximately 21 questions you need to anticipate from common competencies. And in this, the most important one is your history taking. So history taking comprises of one of the major component of your common competency: clinical examination, therapeutic and safe prescribing, decision making and clinical responding, prioritization of patient safety in clinical practice, infection control, managing long-term complication and promoting patient self-care, health promotion and public health, principles of medical ethics and confidentiality, legal framework of practice, evidences and guidelines. Because this is very, very important. So when you go prepare for these exams, there are a lot of legal changes that is going to happen from India or any other country when you are practicing in UK. There's a lot of changes that is going to happen. So you need to understand it better. Maybe history taking, clinical examination, we will be well versed with whatever practices we have been doing right now. But this medical ethics, confidentiality, legal framework of practice, evidences and guidelines, all those things, there are certain changes. So you need to go through it very clearly. As I said, common competencies, you can anticipate around 21 questions from this area. Now coming to the most important part, that is the major and acute presentation. Again, 18 is for your SAQ, that was the previously given. Into 3 you can calculate it again. So somewhere around 55-60 questions you can anticipate from major and acute presentation. So it covers the major chunk of your emergency medicine practice. So that is most importantly the anaphylaxis, cardiorespiratory arrest, management of cardiorespiratory arrest, major trauma, septic patient, approach to a shock patient, unconscious patient, abdominal pain including loin pain, abdominal swelling, mass and constipation, acute back pain, aggressive or disturbed behavior, blackout collapse, breathlessness, chest pain, confusion, acute delirium, cough, cyanosis, diarrhea, dizziness. So it's a huge list. When you go through this list, it comprises of all of your major topics in your emergency medicine. So these are the, you can go through this list like cyanosis, diarrhea, dizziness, vertigo, hematemesis, melena. A to Z will be covered in this curriculum. So that is the acute major competencies one. Now we go to the next, that is the anesthetic competencies, which are the major anesthesia competency that you need to go when you are appearing for a single best answer. So the most important one is the pre-operative assessment, especially the history taking, pre-operative assessment, the clinical examination, assessment of your airway, how will you assess the airway, how will you risk stratify this patient, pre-operative assessment again, specific anesthesia evaluation, pre-medication, induction of general anesthesia, post-operative and recovery room care, management of respiratory and cardiorespiratory arrest, control of infection, introduction to anesthesia for emergency surgery, airway management, which comes in one of the major chunk, procedure sedation, transfer medicine and critical incidents. So again, this transfer medicine is one area that we don't focus much. So again, very important things. So how much of oxygen needed to be carried while you are transferring one patient from one area to another, maybe one hospital to another hospital, maybe inter or intra hospital transfer. So all those things you need to calculate. There are specific formulas for that. So once we start with this videos, we will come to know regarding this. So anesthetic competencies, you can expect 4 into 3, that is somewhere around 12 questions. So you need to again say that it is 4 is for your SAQ. Now I have made it into 3 because we are anticipating from 60 the questions is going to increase to 180. So I have just multiplied it with 3. So as RCM has said, there is no change in syllabus, only the format is going to change. Now intensive care medicine with specific to emergency medicine. So what are the key things? They in the curriculum they have said that they will be asking somewhere around 2 questions for SAQ. Now for SBA you can anticipate around 6 questions. Obtain an arterial blood gas sample safely and interrupt results correctly. So that is very important. Demonstrate aseptic placement of CVC. Connect mechanical ventilator and select initial ventilatory settings. Prescribe safe use of vasoactive drugs and electrolytes. So that is the intensive care medicine that you are supposed to be ready for your when you are planning to appear for your SBA or your SAQ exam. So SAQ is replaced by SBA again. Now there are the additional acute presentation which may be missed during the major acute presentation which we have discussed previously. So again it is going to be somewhere around 18 questions. So major trauma, chest injuries, abdominal trauma, spine, maxillofacial burns, traumatic limb and joint injuries, lower and upper limb, ABC interpretation, abnormal blood glucose, dysuria, emergency airway care. This CT3, that is the CT3, the equivalence of an trainee year 3. That is what they have said here. Needle stick injury, testicular pain and urinary retention. So again you can anticipate somewhere around 18 questions from this area. Now coming to the major chunk, that is the pediatric. You see that after the adult acute presentation, the next major consideration that they have given is for the pediatric presentation, major and acute presentation. That is around 11 questions for your SAQ, and into 3 you can anticipate around 35 questions. So that 35 questions. So again, coming to all the pediatric age groups, your anaphylaxis, stridor, cardiorespiratory arrest, trauma in children, shock child, abdominal pain, acute life-threatening event or bruise, blood disorders, concerning presentation. Among this, one thing more important thing you have to remember is the non-accidental injuries. So again, very unlikely we are encountering it in Indian scenarios, but in UK this is one of the most important, is the non-accidental injury. So you have to anticipate the questions from these areas. Fever, floppy child, pain in children, painful limbs, atraumatic, rashes in children, sore throat. So these are the major and acute presentation from the pediatrics. So again it is 11. Now to the final one, that is the practical procedures. You have 12 for the SAQ into 3, that is around 36 questions. So you will be asked certain questions from these areas. Either it can be an waveform, or it can be a procedure, or directly a complication of the procedure. So you have to be well versed with all these practical procedures, starting with your arterial cannulation. How will you set up an arterial cannula? How will you set up an arterial line? So they will be giving sometimes a trace, and you see what is the problem with this tracing. So you should be very clear how will you doing an arterial line cannulation, as well as how will be setting it up and how will be interpreting the same. And peripheral venous cannulation. So again, the Poissley law, the size of cannula that need to be selected, central venous cannulation, arterial blood gas sampling, lumbar puncture, pleural tap and aspiration, all those anatomical sites, intercostal drain, Seldinger technique, both open and Seldinger, ascitic tap, abdominal paracentesis, airway protection, basic and advanced life support, DC version, knee aspiration, temporary pacing. So when I was appearing for this exam, they have actually given an paced rhythm, and they wanted us to identify what is abnormality in the rhythm. So we need to identify that it is a paced rhythm. So you need to differentiate how a normal rhythm will look like and how a paced rhythm will look like. So there is differentiation features you need to find. Maybe the lead displacement will be there. So you need to answer it accordingly. So that is the question that has been asked. Reduction of dislocation of fractures, large joint examination, wound management, trauma primary survey, initial assessment of an acutely unwell patient, secondary assessment of acutely unwell, connection to a mechanical ventilator, all those initial setups. How will you set up for an ARDS ventilation? What is the FiO2 that you need to set? What is the pressures that you need to set? What is the tidal volume? What is the PEEP that you need to set in? Safe use of drug to facilitate mechanical ventilation, all your paralytic agents, your induction agents, managing a patient fighting in the ventilator, monitoring the respiratory function, delivering a fluid challenge, describe action required for accidental displacement of a tracheal tube or your tracheostomy, your dope. All those things will be asked. So practical procedures. So this is the most important chunk of your examination. So you see after your acute presentation, the next major chunk is the practical followed by your pediatrics. So this is how you need to prepare for your exam. You should be focusing with this curriculum, and as I said, majority of the time they will be sticking to this curriculum and questions will be asked based on this syllabus. So you have to be very clear when you are preparing for your intermediate. Many people, what they do, they will start with something, but at the end of the day they will not be able to finish the curriculum completely, because they will be focusing too much on things that are not very important, rather than they will be focusing too much on certain areas of procedures, but they will miss the major questions which are going to come for the exam. Now the next most important question that arises in front of everyone is that from where should I study for the FRCEM intermediate? So from where do I prepare for these questions? So there are a lot of online platforms that is available. There are different like FRCEM Success, FRCEM Prep, and even RCM itself has given some scenario based questions. From each scenarios they are giving some 9 questions, and also there are very good textbooks. There are like Musa is available, and there are a lot of other textbooks that is available for your preparation, because I don't want to name it, because each and every book is good. There is nothing harm in focusing in one textbook. This is up to your comfort, but what I suggest is that when you are preparing for your FRCEM intermediate, there will be 2 categories of people that usually appear for these exams. One group of students, not patients, exactly students, sorry for that, and it will be students, that those whose students are working, or maybe they are working in the institute as a consultant or maybe a junior specialist, but they want to appear for the MRCEM exam. Second category, those students who are focused to write this exam. So whatever be the category, what I will suggest is approximately a 6 months of preparation time. Ideally a 6 months of preparation time, when you are focusing at least 200 questions a day. So approximately 200 questions a day you need to focus. Either of these platforms you can use. You can go with your FRCEM Success or FRCEM Prep, or from the Royal College of Emergency Medicine, whichever be this thing. At least 200 questions a day, that is my suggestions. But 200 questions per day may be a little bit too much for the initial. Maybe you can start with 50 to 100 and slowly step it up to 200 questions per day. And make sure that you're reading the NICE guidelines. You go through each one of these textbooks. They will have these guidelines. Basically these textbooks are written based on these NICE guidelines and UK practices. So you can go through any of this textbook, and you need to focus on it. So approximately maybe the first 2 months you try finishing one of these books, whichever is available with you. Whichever book that is available. There are basically 2 books as I suggested before. You approximately try to finish off these books within the initial 2 months. Then you start doing these questions. So it is going to be an SBA, that is single best answer. So maybe 200 questions is not going to be a big deal. Maybe you can a little bit do it faster. And also you concentrate more on this pictorial representation, maybe an retina examination, fundoscopy, all those rashes, all those things you need to concentrate. So there are a lot of areas where we commonly miss for preparing an intermediate exams, like as I told before, a driving license. What are the legal aspects for procuring a driving license for a patient in UK? These are the areas that we commonly doesn't practice in India, but it has got a lot of value when we are going to do an appearing for an exam in UK. So this will be my suggestions, and maybe 6 months will be reasonable. But if you want, like if you are a practicing consultant, you don't find enough time, maybe 1 year. But 6 months, if you prepare well with whatever the standard textbooks that is available, and stick to the RCM guidelines, and also the questions that you need to do, approximately 200, that is my suggestion. As I said again, so 200 questions a day, you can easily come through this exam. There is no much difficulty, but the problem is that you should have clearly understand the curriculum, and clearly you need to answer to the point. If it was SAQ, I think it was a little bit difficult, because what it can vary from examiner to examiner, maybe from student to student it can vary. But when it is going to be a single best answer, so the answer is going to be 1. You need to just choose one single best answer. So the passing rate will be more. That's what I believe. Maybe more, and maybe the difficulty of exam maybe little bit changes, because once the exam become easier, so the passing rate also will go up. So previously when it was SIQ, the usually cutoff was somewhere around 110, 120. Now I think it might increase because the SBA will be a little bit more easier. That's what I think so. But whenever the first exam is just going to happen is only when we know exactly what is going to happen. And also one thing that I just wanted to let you know that please go through the previous questions, maybe the last 6 or 7 years. It is easily available. So previous questions, please go through that. There will be a lot of recalls that will be available, and in many of the major discussion groups, whatever, whether we have whether in Telegram or WhatsApp, wherever you have, these questions are easily and freely available. You go through those questions. Usually in SAQ, there are approximately 60% of the questions are repeated. Maybe single best answer, we can also think that from SAQ question, they will be rephrasing it and reformatting it, and you can anticipate a few questions from there also. So that is my suggestion. So now the further coming videos will be on specific scenarios. So how will we approach a patient with chest pain? What are the legal responsibility? So one topics we will take, and we will try to finish as much as possible. So hope this video will be useful for you. Please subscribe to our channel, and please keep following us. Thank you. Thank you for your patient listening.